Hello, everyone. Thank you for joining us today. I am Kathy Roth-Duquet, co-founder and CEO here at Blue Star Families. We're a national military and veteran family-serving nonprofit that's both grassroots to grass tops. We're committed to bringing you the programs and insights you need to help your family thrive. Since March of last year, we've been dedicated to providing you the transparency and the access to experts to help you navigate the pandemic. We're delighted now to partner with the American Red Cross on a new campaign, Team Up to Beat COVID-19, to help military-connected families understand and get access to the vaccine.
Thanks, Kathy, so much. The American Red Cross is super excited to join Blue Star Families as a partner in this important and timely campaign. We have much more information for you today, but first, we have an exciting special guest. We want to kick off today's event with her heartfelt and encouraging words for our military-connected community. Together, the American Red Cross and Blue Star Families are excited to welcome First Lady Jill Biden joining us today from the White House. Thank you, Dr. Biden, for being with us.
A few months ago, I met with a mom dealing with the chaos so many parents have faced over this last year. She had 2 kids who were trying to navigate remote learning while she worked from home. She was worried about keeping them all safe, far away from the help of her family. And all the while, her husband was deployed overseas with his homecoming delayed because of COVID. This last year has been tough on all Americans, but many in our military communities are facing these challenges through deployment while adjusting to a new town or school and without a bubble of friends and family. The President and I know that our military families are strong and resilient. You may not wear a uniform, but you serve in your own way, sacrificing for our country alongside your service member. Making sure you have what you need to thrive isn't just a nice thing to do, it's a matter of national security. And that's especially true as we tackle this virus. You need to feel confident in the health decisions you make for your family. That's why it's so important for us that you have the direct access to the experts, to have an honest and transparent conversation. Your questions matter, and Dr. Fauci and his team are excited to answer them. The fight against COVID is a battle we can win, and brighter days are close. But we need your help. That's why we're encouraging everyone to mask up, socially distance, and get the vaccine when it's your turn. We can beat this together. So thank you for your questions today, and most of all, for your service to our country. Stay safe, and God bless our service members and their families. Thank you.
Thank you, Dr. Biden, for being such an extraordinary friend to military families. We're honored that you prioritize this today. It means so much to our military-connected families and our whole community. We look forward to continuing to work with you to support this community with your Joining Forces initiative and throughout your time as First Lady. Dr. Biden's remarks reflect Blue Star Families' belief that our military force is really a total family force, and we're strongest when our military families are strong too. Based on Blue Star Families' recent pulse check, we know that military families have real concerns and questions about the COVID-19 vaccine, and that's why we're here today, to let people talk directly to the experts. Over half of our respondents said that they did not feel comfortable at this time getting the vaccine, and many remain undecided. Their concerns range from distrust of the vaccine's development process to its safety, overall efficacy, and to the potential for unknown side effects. The concerns that you shared with us are what led us to convene this group of medical experts today. We shared those concerns with Dr. Fauci's team, and he immediately agreed to join us. Throughout today's event, we encourage you to share your thoughts, questions, and concerns in the chat. We're eager to hear from you. We'll do our best to answer as many questions as we can. It's my hope that during today's town hall, we'll get you the answers you need to make the best, safest decisions for your family. And now it's my true honor to welcome Dr. Anthony Fauci to join us today. As you all know, Dr. Fauci has been at the front line of infectious disease research for the past 3 decades, and he's a leading voice on COVID-19 pandemic here in America. Dr. Fauci, we are humbled, excited to have you with us today. We have tens of thousands of military and veteran families watching right now. Thank you for sharing your knowledge and your expertise. Welcome.
Thank you very much, Kathy. It's a real pleasure to be here with you today. Let me first start off by echoing those eloquent words of Dr. Biden and to express my extraordinary respect for the Blue Star families and the Blue Star Family Project. Thank you very much for giving me the opportunity to be with you. Because of this extraordinary respect I have, I would do this anytime that you ask me for it. Let me just spend a couple of minutes just making some general statements, and I know we'll have a lot of questions that relate to the issue of vaccines, but we here in the United States and globally are living through truly a historic and devastating pandemic, which has already killed over 2 million people worldwide, has infected more than 20 million people in the United States, leading to about 430,000 deaths. This is truly historic, the worst of a respiratory disease pandemic that we have seen in over 102 years. We right now, as I speak to you, are still within the grips of this, though even though things begin to plateau and are looking like they're going in the right direction over the last few weeks, we still have between 1 and 200,000 new infections each day, and we have anywhere between 3 and 4,000 deaths per day. That is the sobering and sad news. But the light at the end of the tunnel is the extraordinary success that we've had with the vaccine development program, where the United States government has been responsible for and heavily invested in the development of and/or the facilitation of the testing of 6 vaccine candidates, 2 of which have already received emergency use authorization. And by emergency use authorization means that the vaccines are now available and are being administered to people in the United States. 32 million injections of vaccine have already been given. I might just say very briefly, and then we'll open up for questions. People always ask, well, how do you know that this is a safe and effective vaccine? And what was the process? Well, the 2 vaccines that have already been approved for emergency use are from the company Moderna and Pfizer, and it's what's called a messenger RNA platform. It was tested in 30,000 people in the Moderna trial and in 44,000 people in the Pfizer trial. And the results were striking in the positive sense, a 94 to 95% efficacy against clinically recognizable disease, and in fact, a very strong, almost 100% protection against severe disease leading to death. So the results are extraordinary, but people ask, well, wait a minute, you developed this vaccine literally in less than a year from the time you knew about this new virus. So you always tell us that it takes 5 to 7 to 10 years. How did that happen? Were you reckless? Did you rush? Did you cut corners? And the answer is the speed is completely related to the extraordinary advances in scientific platform technology for vaccines. There were no corners cut. We did not sacrifice safety, nor did we sacrifice scientific integrity. And the decision to determine that the vaccine was safe and effective was made by independent bodies of vaccinologists, scientists, immunologists, statisticians, ethicists that were beholden not to the federal government nor to the companies, but to you, the American public. And that's really important for people to understand. And the decision to decide to administer it was again made by professional career scientists at the FDA in association with their own independent advisory board. So those decisions were both independent and transparent. And that's the reason why many of you hear me every day in the media saying, when your turn comes up, please get vaccinated, both for your own safety, for that of your family, and that for the American community in general. So Kathy, I'll stop there and be very happy to answer questions.
Thank you. I have a great many for you, so I'll try to go through them quickly. Probably one of the most questions we're asked the most is the one that you just talked about now, which was about the vaccine safety and the development process. Did part of this process start earlier than March of last year?
Oh, absolutely. And I think that's a good question, Kathy. And that's the reason why people sometimes get a misinterpretation. The science behind the development of this extraordinary new technology dates back well over a decade. And the people at the NIH who were working on this particular technology had been doing it for at least the last 10 years. And it was just so happened that by the time we actually needed it for the vaccine for COVID-19, it just happened to coincide with the scientific culmination of work that had been going on for so long.
And I think one of those doctors is my neighbor, Libby Higgs, so I have to give her a shout out.
Yes, she's part of the team.
Yeah. We had a lot of questions about side effects. Should people be concerned about side effects for this?
Well, in general, if you look at the safety of vaccines in general, any vaccine, the risk-benefit ratio of safety is about as good as you could get with any medical intervention that you give to anyone. The safety record for this, even though it's just been 1 year, has been really quite good. There have been some allergic reactions ranging from anywhere from 1 to 6 per million of people who have a very strong history of severe allergic reactions. And what we tell those people is that, A, you should get vaccinated. But if you do, which we will strongly recommend, that you do it in a place that has the capability of treating an allergic reaction, namely in a clinic of some sort where you can get vaccinated. But that's a very rare adverse event. For everybody else, the vaccine looks quite safe.
Great. Are there current recommendations for children under 18? And especially, we're having a lot of concerns about pregnant women. What are the recommendations there?
Okay, so in one trial, individuals as young as 16 and then down to 12 have been tested. In the other, it was 18, but not below. In general, when you do vaccine studies, you don't put children right into the trial because children are vulnerable. So you wait until you get pretty confident that you're dealing with a safe and effective vaccine. And then you could start trials in children, which we have already done and will be doing over the next month or two, in what's called an age de-escalation study. So you start off with older children, and then you work you down to less old, younger, and then really young children. And then what you do is you get safety and immunogenicity data, and you bridge it to the efficacy data from the big trial, which means you don't have to test 30,000 or 44,000 children. You can get enough data from a smaller trial. With regard to pregnant women were not allowed in the initial trial, again, because pregnancy has a degree of vulnerability. So we did not do that. We're going to start tests in pregnant women literally now. I mean, as I'm speaking, they're starting and will go into February and March. One good news item is that after the EUA was delivered, and namely until people started getting vaccinated, there have been about 10,000 pregnant women out of the 32 million people or vaccinations that were given, and there have been no red flag signals. The FDA is monitoring that. So thus far, it looks quite safe for pregnant women. In fact, many of the pregnant women who decided they wanted to get vaccinated, even though they were not in the clinical trial, were actually healthcare providers who were deciding that the risk of getting COVID from their patients was far greater than any potential for adverse events from the vaccine. And in doing so, as I said, thus far, there have been no red flags of adverse events.
So here's a question. Do we know if the pregnant mother got the vaccine? Is the baby have some immunity?
Well, I mean, if it happens the way it happens with any type of vaccination, that the mother's antibodies, particularly the IgG antibodies, are passed through to the baby, so that the baby, for a certain amount of time, measured generally in months, will have immunity because of the passive transfer through the placenta into the baby, and also by breastfeeding.
That's very interesting. So right now, 18-year-olds, if the vaccine becomes available to them, it's safe from 18 up.
Yep, absolutely.
Great. I've had some questions about how does mRNA vaccine work in specific? What does that mean?
Okay, so RNA is the general molecular mechanism whereby we make all of the proteins and cells in our body. What it is that mRNA, and M stands for messenger. So it's a message to tell the body to make a protein. So when you get an mRNA vaccine, you stick in the coding sequence to make one of the components of SARS-CoV-2, and it's called the spike protein. And the spike protein is the part that sticks out from the virus, which makes it look like a crown.
Right.
That's why they call it coronavirus, because corona stands for crown.
Yeah.
And what happens is that when the mRNA codes for that protein, when you inject the mRNA into your muscle, it starts to code for a protein. The body sees the spike protein and thinks it's the virus.
Yeah.
But it's not the virus. It's one harmless component of the virus. So the body makes a nice response so that when the real virus tries to enter your body, you have a bunch of proteins called antibodies that jump all over that virus and prevent it from infecting you. So that's how it works.
So when people are concerned that they're getting something harmful with the vaccine, they really aren't. They're getting a faux coronavirus.
Oh, absolutely. It's impossible to get infected with coronavirus from the vaccine, because the vaccine codes for a soluble protein that induces the body. The other thing that's a question that everybody asks, well, this is RNA. Is that going to get into my genes and do something to my, and the answer is absolutely not. This is a messenger RNA that decays after a couple of days and then it's gone forever. You don't have to worry about
it. That's good. So will this be administered annually, do we think? Is this going to be a yearly shot like the flu vaccine?
Well, you know, honestly, we don't know the answer to that because we don't know what the durability of the vaccine, of the immune response to the vaccine is going to be. We hope it's longer than a year, and we hope that we get control of these variants or these mutations that occur so they don't obligate us to have to upgrade the vaccine every year. But if we have to do that, which I hope we don't, then that is not very difficult to do. It can easily be done.
Good. I have someone saying, I've got an autoimmune disease. Should I avoid the vaccine?
No. In fact, that's one of the good reasons why you should get vaccinated, because if you have an autoimmune disease, the likelihood is that you're on some form of therapy like glucocorticoids or prednisone, as it were, to suppress the autoimmunity. If you are, then your body is immune compromised, which means you are more vulnerable to the serious outcome if in fact you do get infected with SARS-CoV-2. So even though your immune response may not be as robust as someone who has a normal immune response and is not immunosuppressed, still some response is always better than no response.
Yeah.
So for the people who have underlying conditions, they often ask me the question, does that mean I should not get vaccinated?
Right.
And my response is, on the contrary, that's more reason why you should get vaccinated.
Right. Good. Can you still be contagious after receiving the vaccine?
You know, theoretically, we haven't proven that you cannot be. You might be contagious. And the reason is that the endpoint of the study was efficacy against clinically relevant, clinically apparent disease. It is conceivable that because you're vaccinated, that you could get infected, but have no symptoms. And then what happens is that if that's the case, you would have vaccine in your nasopharynx and you could conceivably spread it to someone else, which is one of the reasons why we say after you get vaccinated, you can't just throw your mask away. You've got to out there in the community, continue to wear a mask. You're much more protected, but you've got to make sure you protect other people.
Well, my staff is pinging me that I'm going to have to let you go. You're a busy man, but this has been so wonderful. And I may impose on you to ask you to come back in a couple months and talk to us again, because you've been so kind. I can't thank you enough. I know all of our families, our veterans, military members, and their families have learned so much from hearing from you today. Thank you for helping them make informed decisions for themselves and their families. We're grateful to you. Thank you.
Thank you very much, Kathy. Very good to be with you. Thank you.
Okay. Well, that's pretty amazing. Before we hear from our senior leaders from the Defense Health Agency and the Veterans Health Agency, and you'll have a chance to ask them questions specific to your situation, I'm honored and excited to welcome the chairman of the Joint Chiefs of Staff, Mark Milley, and our friend, Mrs. Hollyanne Milley. General Milley has the backs not only of our service members, but their families too. He's prioritized all of us, and I'm personally grateful for his leadership. Hollyanne Milley has been deeply committed to many military serving nonprofits, including Blue Star Families and the Red Cross. She's been a leader in the collaborative COVID-19 response initiative across our community. She's headlined several of our town halls over the past year. She's a healthcare worker herself, so Mrs. Milley brings firsthand insight to the pandemic. Thank you both for sharing your personal experience with us today.
Good afternoon to all of our soldiers, sailors, airmen, Marines, Coast Guardsmen, and Guardians, and all of our military families. I'm here with my spouse, Hollyanne, and first, we would like to thank the team at Blue Star Families for hosting this informative town hall and for the many programs and initiatives that they sponsor to support our service members and their loved ones. Today, we're here to talk about the COVID-19 vaccine and protecting the 2.3 million men and women who wear the cloth of our nation, and equally important, the 2.7 million military family members faithfully serving by our side. We are both committed to the health and well-being of all of you.
More than 33 million Americans have received at least one dose of a COVID-19 vaccine. As we all have seen, the pandemic has significantly impacted our country. To date, 26 million Americans have been infected with COVID-19, and more than 440,000 lives have been lost. We mourn alongside the families who are grieving the loss of their loved ones, and we are all, as a nation, committed to ending this horrible pandemic together. As a currently practicing healthcare professional who has been a nurse for over 3 decades, the keys to defeating this disease are to maintain our social distance, to always practice personal hygiene, especially washing our hands, and to continue wearing our masks when in the proximity of other people. And finally, now we are administering vaccines to those who wish to take them. According to the CDC, vaccines save lives and reduce the spread of disease. The data show COVID-19 vaccine is extremely promising in immunizing a person against the disease.
The National Institutes of Health state that both FDA-approved vaccines currently available for emergency use in the United States have been shown to be safe and highly effective at preventing COVID-19. Since the beginning of the pandemic, the Joint Force has supported combating the virus by all means necessary. When called into the fight, we commissioned our best talent to aid in accelerated development, manufacturing, and distribution of the vaccine through Operation Warp Speed, a whole of nation response. And right now, more than 22,000 National Guard personnel in 33 states are supporting efforts in vaccine administration. With that in mind, getting the vaccine is a personal decision. So we both encourage you to consult your primary care physician to address any concerns about being vaccinated. Arm yourself with credible information about the COVID-19 vaccine so you can be well equipped to make the right decision for you and your family. Protect yourself, protect your families, and protect our communities. Together, we can all lead the way for the nation in the fight against COVID-19.
Thank you so much, General and Mrs. Milley, for sharing that inspiring message with us today. We're grateful for your leadership. Thank you in particular to Mrs. Milley, a longtime Red Cross volunteer herself. And now I'd like to start off the Military Connected Families portion of the event. In order to do that, I want to welcome Lieutenant General Ronald Place. General Place is the director at the Defense Health Agency. Lieutenant General Place has led a distinguished career in the U.S. Army and currently leads a joint integrated combat support agency enabling the Army, Navy, and Air Force medical services to provide both a medically ready force and a ready medical force to the combatant commands. This is done in both peacetime and wartime. Lieutenant General Place, welcome. Please say a few words.
Thanks for the introduction, Kobe. Good afternoon to everyone at Blue Star Families, and thanks for inviting me to join you today. It's an honor for me to share the program with General Milley and Dr. Fauci, two giants in public service to our nation. And I deeply appreciate that Blue Star Families is hosting such an important forum and helping us communicate on an incredibly important issue for you, for your families, and for all Americans. For almost 12 long months, we've been in this battle together, and the only way out of it is together. I'll start by restating what Generals Milley, Mrs. Milley, and Dr. Fauci have already communicated, and I'll add on an essential point. By signing up for this event and hearing the latest information, you're ambassadors too. And I hope you share what you hear today with others, because data show that the likelihood of individuals receiving this vaccine and sharing their experiences have a statistically significant effect on the likelihood of family, friends, and colleagues deciding to get the vaccine. As a physician, I know that patients are likely to listen to me, but your community is likely to listen to you as well. So however works best for you, in person, in your place of worship, on your social media sites, or a simple email. So thanks for having me, and I'm eager to get to the Q&A. Over to you, Kobe.
Thanks, General Place. Now we'd like to ask you a few questions submitted by the audience, and I received a lot of questions via email. Many families have questions about how to access the vaccine in their areas. So should they go to their local military treatment facility, their MTF, or should they seek out the vaccine off of the installation?
Well, sure. So first, no one, whether they rely on an MTF for care or not, is compelled to come to an MTF to get a vaccine. If it's available in the community and easier for you to get it there, then get it at your first opportunity. If you normally get care in an MTF, please let us know if you get the vaccine somewhere else so we can update your records. And our local MTFs will be reaching out to individuals through calls, secure messages, the media, to let people know when we've reached their population group. And we've started that work for some individuals over 75 years of age in some locations and hope to expand soon to individuals 65 and older. Second, for beneficiaries who live near an MTF but don't rely on us for care, we're also going to be offering vaccines to you. Now, we're working with the Department of Health and Human Services and requesting vaccine for both MTF users and other beneficiaries in our local communities. And then third, for beneficiaries far from an MTF, and for us that means those who live approximately 40 miles away or more, we're doing several things. We're encouraging individuals to take the vaccine, like this discussion today. We're directing people to their state, county, local resources. We're working with our TRICARE contractors to ensure communication flows from individual providers to their patients. And we're reaching out through military service organizations like all of you at the Blue Star Families to help steer families in the right direction. In most cases, these individuals have a civilian healthcare provider who's also helping them with this information.
That's really great information, General Place. I appreciate that answer. A number of families have also asked, how will the vaccine be distributed overseas? We have lots of families, OCONUS, plenty of folks that are concerned about how do we get the vaccine overseas? Can you share a little bit about that process?
Well, we're shipping vaccine overseas right now and moving through a phased model, same phased model we're using here in the United States. For the most part, we've not yet reached healthy family members. Military families overseas are in the requirements we provided to Health and Human Services and the CDC. But here's the good news. We've shipped and administered vaccine for military families overseas for decades. We have processes in place to receive and then administer the COVID vaccine, just as we do for every other vaccine. Now, obviously, for right now, we're not going to be vaccinating anyone under 18 years of age overseas because Pfizer is not shipping their vaccine overseas, so we're only using the Moderna vaccine for our overseas families, and that vaccine is only approved for adults, so 18 years of age and older. But to say again, both military families overseas and here in the United States are in our requirements plan for receiving vaccines.
Okay, we got it. So very important information for our OCONUS team members. Now, General Pace, we'd love to know, what can you tell us about distribution to the National Guard and Reserve service members and their families?
Yeah, I'm glad you asked that question. In some cases, military reserve families feel forgotten. And so when we're talking about reservists and their families, the answers can get relatively complex. So I want to be very accurate here. So first, the reserve community, both National Guard and reserve units, are receiving vaccine, and they're part of our DoD requirements. These units are being vaccinated now. Second, as far as reservist families go, if the reserve or guard member is activated for 30 days or more, their family members are also eligible for care in every one of our MTFs. However, right now, we're not vaccinating healthy beneficiaries under the age of 65 beyond healthcare workers, first responders, or individuals in critical national security position. So each location will have some variation on where they are in their phase based on the population they're serving. But we will vaccinate families of activated reserve and guard members. For everyone else, stay attuned to your local sources on the availability of vaccine from your civilian community.
Thank you, Lieutenant General Place. I know that our military-connected families that are gathered here really do appreciate your willingness to share insights also all around the world. So we look forward to continued collaboration with you and your team in the months to come. So now it's my great pleasure to welcome Dr. Richard Stone. Dr. Stone is the Acting Undersecretary for Health at the Veterans Health Administration. Dr. Stone currently directs the Veterans Healthcare System, overseeing the delivery of care to more than 9 million enrolled veterans. Dr. Stone, would you like to say a few words?
Well, thank you. And thank you all for joining us today. And thank you to President Biden and our First Lady for their commitment to military and veteran families. I'm honored to be here with my fellow civil servants and military leaders. And I'm Dr. Richard Stone. I'm a 23-year Army veteran, and I'm a doctor who has practiced actively for over 40 years. I finished my military career as the Deputy Surgeon General of the Army, and I've been running the Veterans Health Administration for the past 2.5 years. Today, I represent very proudly almost 370,000 VA employees who are deeply committed to our mission of caring for America's service members and veterans. Military families are used to leading our nation, and I want to thank you all for setting an example for all of Americans in helping us defeat COVID-19. Your leadership in masking and practicing physical distancing have helped slow the spread of this virus. And we're here today to answer your questions about vaccinations and to help end this pandemic. I also want to focus on our caregivers of our veterans and to ensure that they are healthy and able to continue their important work. We're going to begin offering COVID-19 testing and vaccinations to designated family caregivers of veterans participating in what we call the Program of Comprehensive Assistance for Family Caregivers. I want you to contact your facility's caregiver support coordinator for more information on this important program. Now, I know that there are a lot of questions out there about the vaccine, and I want every veteran and every family member and every service member to know that they should talk to their own medical provider, either at the VA or at an MTF or elsewhere, if they have questions. You know, VA yesterday delivered its 1 millionth dose of vaccine to veterans and employees. I'm looking forward to taking your questions and honoring your service to the nation. Thanks so much for all you do. Thank you, Kobe.
Dr. Stone, thank you, and Department of Veterans Affairs and Veterans Health Administration. We appreciate having a representative from the VA to speak with us today and to the veteran community as well. So I'd like to ask a couple questions submitted by our audience. We've had over 1,000 questions that have been emailed and submitted. And I know the audience gathered here today is also super eager to hear what you have to say. So first question, 1/3 of veteran family respondents who say they won't receive the vaccine report that they aren't doing so because of personal health reasons. So they might be immunocompromised as an example. So what are the current recommendations for immunocompromised veterans and their families?
Well, as Dr. Fauci mentioned just a few minutes ago, immunocompromised individuals are at greater risk of COVID and severe COVID. And one of the things we need to do is to recognize the fact that if you're at great risk, you should be getting the vaccine. Taking the vaccine is a very personal decision, and many of those personal decisions should be discussed with your healthcare provider. But you know, our 370,000 employees who've been on the front lines of this pandemic for the last year have lined up to get this vaccine. Over 85% of VA employees have now had at least their first immunization. It's an extraordinary testament to the fact that we believe it's safe and we're lining up to get it ourselves.
Thank you. That's super helpful information. You know, we're a part of a larger veteran military family community. I was reminded recently by some of our nonprofit friends at places like MOA, TAPS, AUSA, and Armed Forces YMCA, and they ask a lot of questions. One of the consistent questions we get are the fact that many people in our veteran military family community don't receive their medical care from an MTF or even from a VA health clinic. And sometimes they don't live particularly close to those locations either. So how can they access up-to-date information or even sign up to receive the vaccine?
Well, we know that over half of our veterans, half of our enrolled population live in rural areas, a long way from even our 1,700 sites of care delivery. We have over 215 sites delivering vaccine today, and we'll expand it. But we would encourage all veterans or interested families to go to va.gov. And if you look at that website, if you go to the top, you'll see a site that says, keep me informed, and it'll give you all the information you need. Or go to their local VA medical center or closest VA medical center website and do the same thing, and it'll help keep you informed. We've also been reaching out in some pretty unique ways. In fact, yesterday, we immunized 500 veterans in rural Montana, where we literally flew in the vaccine to that community on a small airplane in the midst of the winter in order to reach veterans and their families. We're working hard to get this vaccine out to as many people as we can. And I'm really encouraged that so many of our veterans have expressed an interest in being vaccinated. We're still getting through our high-risk individuals, are over 75 years old or over 65 years old, depending on the area of the country that you're in. But we're trying to get to everybody that wants the vaccine as quickly as possible.
Thanks, Dr. Stone. And va.gov, sign up for the updates. I actually signed up myself, and I can testify that it works. I'm a combat veteran myself, and I did sign up for the updates. So we really appreciate that's fantastic way to get information about the vaccine for our veteran community. The next question is really about how family members receive the vaccine. And the question is, can family members receive the vaccine through the local community healthcare provider or at MTF or a VA facility?
Well, family members, unless they're engaged in our caregiver program, will need to go to their local community in order to get the vaccine delivered. And at this time, we have enough vaccine to vaccinate our high-risk veterans, but not the family members. And just as General Place had discussed, we'll need to depend on the commercial or the civilian delivery system to help support that. And so contact your local community health department and see if you can get on the list to be vaccinated. I know this can be really frustrating, Kobe, and there's a lot of people that want this. You know, most of our research shows that as much as 85% of people want the vaccine, and of the people that are concerned about it, they mainly want to see that it's safe before they decide to actually take the vaccine. But the vast majority of them, once they are convinced that it's safe, will go ahead and get the vaccine. And it's why this effort is so important, to just allow people a chance to have their questions answered in this kind of forum. And I congratulate the Red Cross and Blue Star families for really conducting this kind of forum.
Thanks, Dr. Stone. So my dad's a veteran and an Army veteran. He's in his 80s and he recently got his vaccine. But that was the big question until he got it. And the question that he had and so many other family members have is, you know, when do you think your average family member, middle-aged, good health, when can we get the vaccine? Well, it's the big question. And the question really relates to how much vaccine we have. And we're prioritizing based on risk. And right now, I would tell you, I can't predict exactly when that will be available. What I can tell you is that the manufacturers are telling us that they will continue to increase their production of vaccine as we go through the next few weeks. And it's our hope that as we reach the months of March and the end of March, that we'll see dramatic increases in the amount of vaccine that's available, and we can begin to approach some of the lower risk populations. But what's encouraging is how many people have signed up to stay informed, to call, to talk to their providers and say, where am I on the list? And when do you think this will reach me? That's a very good sign. You know, all of us want to get through this last mile of this pandemic, and it's going to seem like an awful long mile waiting for the vaccine to come. But none of us are going to be able to resume our lives and be able to get out and do the things we want to do until we get to the point of at least 60 or 70% of the American population immunized. How long the immunization will last is something that Dr. Fauci will answer for us with his team. Until then, our job is to get as much information as we can and then make an informed decision for ourselves and for our families. Thanks, Dr. Stone. Patience. So it is a long last mile, but we will be patient and we will wait our turn and continue to provide the safety and secure environment that we all deserve, wearing our masks, washing our hands, socially distanced. Thank you for your time today and your expertise. I know that those that are gathered here appreciate your willingness to share your insights on the vaccine's effectiveness, as well as the rollout within the veteran community. So we'll keep in touch with you and your team in the coming weeks and months and continue to share important information and updates from the Department of Veterans Affairs and the Veterans Health Administration. Dr. Stone, thank you so much.
Thank you, Kobe.
So now it's my honor to welcome Senior Enlisted Advisor to the Chairman, Ramón Colón-López and Janet Colón. The SEAC and Mrs. Colón have been integral to both the readiness and morale of our service members and their families. Throughout the pandemic, the SEAC has served as a key advisor to the Chairman. So thank you both for your time and taking the time to share with us today.
Thank you to Blue Star families for giving us the opportunity to speak on this important issue. My wife, Janet, and I would like to take a moment to emphasize how much we genuinely care about the health and well-being of all of our service members and their families. It is because of your commitment and your family's unwavering support that we have the freedoms we share in this great nation. Also, we would like to thank the 22,000 National Guard personnel that are on the front lines providing support during the pandemic, and all of the healthcare workers across the nation. All of the speakers at this town hall have provided some great information on vaccinations and the importance for each of you to research factual information and make the best decisions for your families.
You are our top priority, and we pledge to always get the facts to you first. We ask that you keep an open mind about the vaccine. Do not let social media drive your decision, and stay updated. We understand the struggle with this vaccine decision, and we have had the same conversation in our home. We encourage you to work with your primary care doctor to address concerns you may have about getting vaccinated.
While Janet has yet to receive her vaccine, I recently received my second dose of the COVID-19 vaccination. I'm glad to say that I had a sore arm that subsided within a day as the only side effect. And I credit much of that to staying healthy and fit.
A healthy immune system is a great first line of defense against illness. Do not let quarantines, lockdowns, and social distancing keep you from staying active. Get creative and develop the right habits to stay fit, all while staying safe.
Throughout history, our country has repeatedly demonstrated toughness and determination in the face of adversity. This battle with COVID-19 has been no different. Our service members and their families have continued to endure continuous training, deployments, and have provided steadfast support to our communities.
While we hope all the risks and consequences of this virus will soon subside, we are very much still in the fight. Do not become complacent and do not lose focus.
Stay vigilant and continue engaging this enemy we call COVID-19. With a concerted effort from the entire force, we can and will effectively combat COVID-19. Thank you. Rely on the facts.
And stay healthy.
We've been so fortunate to share this hour with our panelists and with all of you. I want to let you know that we remain committed to bringing you information, such as the information we brought you today, and to dig into how we can help all of us safely get access to the vaccine so that we can continue on our mission of protecting this country that we all love so much. Kobe?
I'm back. Kathy, thank you so much. This has been fantastic. And hopefully we'll be able to hear from the SEAC. He's so inspiring to so many of us. When I was in the military as an officer, it's the enlisted advisors that keep you straight, and the information that they share is so critical for our junior enlisted and our enlisted and our officer corps, to be completely frank with you. Thanks for joining us, on the webinar. I just want to say thank you to everybody. We do hope that the experts that have gathered here today to help provide us with this information, and hopefully this information will help everybody make the best decisions for their own families as it relates to the COVID-19 vaccine. Over the last year, more than 70,000 people across the country joined the Red Cross as volunteers. Volunteerism is extraordinarily important to our community mission. And if you'd like to help other nonprofits like Blue Star Families and the American Red Cross deliver its life-saving mission to military-connected communities during this public health emergency, please consider volunteering. You can visit many sites like serve.gov, and they'll help you get connected with an important community service opportunity.
Kobe, thank you for joining me today, and thank you to the American Red Cross for co-sponsoring this event and the coming campaign with us. I would like to take a moment to thank our event sponsors, both for this town hall series, Home Front and the Front Lines, and for our new campaign, Team Up Against COVID-19, in partnership with the American Red Cross. Today's town hall will be available online through Blue Star Family's website. So please share it with others. And if you did come in at the beginning, come to us now. See the post-event email for a link for resources provided by today's participant and to watch the event recording. Thank you again for joining us today. Everyone, have a great afternoon.